This is Radio Boston. I'm Tiziana Deering. Nurses at St. Vincent Hospital in Worcester remain without a contract today after a mediator ended talks between them and Dallas-based Tenet Healthcare. The talks began just yesterday. Now, this after 149 days on the picket line. The group representing the nurses, the Massachusetts Nurses Association, says that it is the longest strike of its kind nationwide in the last decade. At issue, staffing levels, a particularly sensitive issue for hospitals during the pandemic. Cyrus Moulton is a reporter with the Telegram and Gazette in Worcester and has covered the strike from the beginning. Cyrus, welcome to Radio Boston.
Hi, how are you?
I'm great, thanks. Cyrus, 149-day strike. Talks ended today. How did we get here?
Well, it's been a long time coming. It's the negotiations for the contract actually began 2 years before this strike was went into effect in March. So there's been a long history of talks between the two that so far has not resolved.
So break this down for us. What do the nurses want right now? What are they asking for in a new contract?
Sure. The nurses the primary issue, as you mentioned, is staffing levels. The nurses are mainly advocating for a 1-to-4 ratio of nurses to patients on medical surgical floors and telemetry units in most cases, with a resource nurse to pitch in and increase staffing in the emergency department and ancillary support in each unit. The nurses have said that the current primarily 1-to-5 ratio of nurse to patients is unsafe. Tenet Healthcare, the owner and operator of St. Vincent, originally proposed a 1-to-4 ratio on 3 of 8 medical surgical floors, also proposed a 1-to-2 ratio in the progressive care unit and another critical care float nurse to address additional patient loads. And the hospital and union have mostly declined to speak specifics in their subsequent proposals, especially lately, but the hospital has made concessions such as adopting the staffing language at UMass Memorial that nurses at St. Vincent's have publicly praised since, but so far, no resolution.
So, I think none of us are really strangers to explosive labor negotiations throughout history. We've heard some stories, but this is a really big one. And, 149 days on strike, longest strike in the last 10 years, only 2 days in conversations, and the mediator ends it. Why is it so hard for these two parties to come to agreement?
Well, I think that they were talking today, which was a hopeful sign. But overall, I think the atmosphere between the nurses and the hospital is very strained. As I mentioned, although the strike began March 8th, contract negotiations have been going on for 2 years prior, so the union and hospital management had long been at odds over the next contract. And in fact, the nurses union took a vote of no confidence in the hospital CEO after furloughs at the hospital began in April 2020. Both sides have said that the other is rather disingenuous. The last week's announcement of some service cutbacks at the hospital said the nurses have chosen to strike on a platform full of false allegations about staffing, quality, and safety, and the nurses called the cutbacks a ploy. The hospital's decision in mid-May to begin hiring permanent replacement nurses also did not help relations, with nurses saying it only strengthened their resolve to be out on strike. And then there's a history between Tenet and St. Vincent nurses. In 2000, about 600 St. Vincent nurses went on strike, which ended 49 days later with a contract. It was the first nurses contract and came after the nurses had organized into a union. And speaking with nurses and reading coverage from the time, the issues of safe staffing levels, as well as a feeling that healthcare was becoming more corporate, were issues then as now.
So there's some precedent there. Let's step back for just a minute, Cyrus. This is taking place during a pandemic where we know hospital workers have been maxed out, stressed out, fatigued and exhausted. Do you think, and do we have evidence to believe that the pandemic was part of what has made this so, what's the word I'm looking for? Hostile or tense?
Yeah, I think that that's absolutely the case. The COVID pandemic was awful for healthcare workers across the country. And I think that what really was an issue here was the feeling that the hospital management wasn't supporting the nurses. They had furloughs, for instance, and the hospital says that they were voluntary. The nurses union disputes that, but the union has said that they had, that PPE was under kind of lock and key, and issues of PPE. It's been really tough for healthcare workers.
So I'm sorry, I didn't mean to interrupt you there. I thought you were taking a break there. I do want to ask you one last question briefly. What happens now? Talks ended today. What's the next step for each side, just briefly?
Well, talks ended today without a resolution. The nurses have said that they are that a mediator suggested moving the talks to a national level, which provides another set of eyes on it, from what I understand. That just happened a few minutes ago, so I'm trying to catch up on it as we speak.
Sure.
But apparently that there was no agreement to do that at this time. So we're kind of back at a situation where we've had talks. They haven't gotten to a resolution. It's unclear who makes the next step, and that
we'll all be watching.
Difficult to say.
Yeah. All right. That is Cyrus Moulton, reporter with the Telegram and Gazette in Worcester. Cyrus, thanks for catching us up. Appreciate it.
Thank you.
Let's turn to the MBTA, where we now know more about Friday afternoon's Green Line B train crash. So the rearmost westbound train was going 30 miles per hour in a 10-mile-per-hour zone, according to a preliminary investigation by the National Transportation and Safety Board. It hit a second train from behind near Babcock Street, injuring 25 people and causing visible damage to both vehicles and damaging the infrastructure. Here's MBTA General Manager Steve Poftak at the scene of the crash.
We will obviously get to the bottom of this. This should not happen, and we will find out why it happened, and we'll ensure that it won't happen again.
So what went wrong, and what else might an investigation uncover? Joining us now to talk about it, Jared Johnson, the executive director of the transit advocacy group Transit Matters. Jared, welcome back to Radio Boston.
Thank you. Thanks for having me on.
So I'm going to start just by asking you, what was your initial reaction when you heard about and then saw photos from the crash on Friday?
Yeah, I think my initial reaction was just making sure that everyone was okay, and thankfully, no one was seriously injured. And then, the next step was wanting to figure out what happened. So I'm looking forward to the safety panel's review.
All right. So the biggest unknown is, sort of the official cause of the crash. We just gave the latest headline a second ago, and the National Transportation and Safety Board has yet to state the cause. We know, for example, a transportation expert told CBS Boston that accidents like this are usually caused by either mechanical failure or human error. So depending on what the NTSB finds, what's the next step? And as a transit advocate, what do you want to see?
Yeah, as a result of the derailment back in 2019, there was a safety panel set up, and there were a number of recommendations made from that safety panel. And so I really want to make sure that those recommendations are fully funded, and that the T really keeps their eye on the ball when it comes to state of good repair. That's repairing all of the infrastructure, the track, the signals, getting those new cars, on the track, the red line, the orange line cars, and the green line ones that are still in the queue. So that's really key for me is really making sure that all of those recommendations are fully funded, and that any changes related to personnel, that those are implemented as soon as possible.
So I want to pick up on that. So you talked about the derailment in 2019. There were also crashes in 2008 and 2009. And after those, the National Transportation Safety Board recommended that the T install what's called a positive train control system that could prevent collisions between trains. The T currently has installed the system on the red, blue, and orange lines, the commuter rail. But it actually, that was 13 years ago, and it only authorized in January 2020 a contract for a new $170 million protection system on the green line. It doesn't begin till next year. It'll be completed by 2024. But we know the accidents, at least one of the accidents in 08 and 09, was on the green line. I think they both were. So what to do? You say you want to make sure they're funded, you want to make sure the staffing is there, but we saw a 13-year lag. Are you concerned about that? And what does that mean for making sure this really, really doesn't happen again?
Yeah, in the past, there wasn't the funding or the staff. In the past, the T has only been able to spend about $300 or $400 million a year, and now they're able to spend about 4 or 5 times that. So it's disappointing that the system is going to take longer to implement than we would like to see. But they are spending more money. They do now have the capability to get more of these projects online. So one of the other holdups is that the FCC has to regulate the radio technology that's going to be used in this system. And so I really want to see that. I really want to see that waiver be granted to the MBTA so that they can keep this project on track.
One of the things that occurred to me when I heard about the crash, here we are coming out of a pandemic. There's a lot of concern about traffic on the roads already being back to pre-pandemic level, reticence for people to return to public transportation, especially with the Delta variant and what we're learning about, the levels of contagion there. How does the T convince people that it is safe in every way to get back on the T and get ridership back up, especially in the face of something like this, Jared?
I think it's incumbent on really sort of everyone to make sure that we're thinking about this that we're thinking about this sort of in what's the way I want to phrase this? They were really thinking about this in the context of everything. The same day that there was a crash on the green line, there was a pedestrian fatality that got almost no news. And a few days before that, there was the truck crash on 93 that closed down multiple lanes of traffic for I think the better part of a week and damaged the structure above. So so we've got that on one side, and then we have the concern about the Delta variant, but we don't see restaurants and other indoor spaces closing. So I think we have to make sure that we're not letting some pre-existing biases really influence how we're thinking about the T. I have been taking the T since late spring, early summer of last year, and I feel safe when I'm on the T. The vast majority of folks in my just amateur analysis, well over 90% of the folks on the train are following the mask mandate. Of course, I'm concerned about what happened on the green line, but even though the T has more derailments than a lot of peer agencies, it is still statistically way safer than the roads. Last year, we actually saw an increase we saw either a slight increase or right around the same amount of traffic fatalities, even though for 4 or 5 months, the roadway volumes really dropped. So I think that's some of it. And the T, I think, has done a really good job with their new campaign to encourage people to get back on the T.
All right. That is Jared Johnson, Executive Director of Transit Matters. Jared, thanks for joining us. Good to talk to you.
Of course. Thanks for having me. Appreciate it.
Throughout the summer, we are inviting the major candidates officially running for governor to make their case to you. Last month, we spoke to Republican candidate and former state representative Jeff Deal, Democratic candidate and state senator Sonia Chang Diaz, and Democratic candidate and former state senator Ben Downing. You can find those conversations on our website, radioboston.org. Well, today we welcome Harvard professor Danielle Allen. She is also running to be the Democratic candidate for governor. Danielle Allen, welcome to Radio Boston.
Thank you so much, Tiziana. It's great to be here.
So I want to start with a question that I have asked every candidate who's joined us. Here in 2021, what makes you better than anyone else to be governor now and to run this Commonwealth?
I combine a vision for what we could be if we work on behalf of all of us together, which is one Commonwealth. I combine vision with management capacity, 20 years of experience leading organizations at all scales, from small startups to a $6 billion philanthropy, and clarity about what we need for an economy that supports growth and development in the whole of our Commonwealth and connects everybody to opportunity and security.
If elected and your vision were in action, what would be different, really fundamentally different in the Commonwealth of Massachusetts?
Well, first of all, we would all be able to see what's happening in the whole Commonwealth. So for folks who live in the Boston area, often people don't know that 20% of the people in Lowell and Lawrence and north of that in Amherst are living in poverty, for example. People often don't know that Springfield is the asthma capital of the country. People don't know that folks have been living in the woods in Western Mass and on Martha's Vineyard. So for starters, we would see our whole Commonwealth, and we would understand that in order to connect everybody to opportunity and security, what we really need to do is invest in basic building blocks of infrastructure, social infrastructure, housing, transportation, schools, good jobs, and justice. So for starters, it's really critical. We need an abundant supply of affordable, accessible housing all over the Commonwealth. And we also really need to have a modernized transportation infrastructure. Those two parts of infrastructure are really strangling our economy, especially outside of Route 128. We have to do work of transformation to ensure that the entire Commonwealth is connected to a growing, prosperous economy. I did a lot of work on COVID last year. I spent just tons of time digging in all levels, city, state, federal, really working to build out infrastructure for testing, working on contact tracing and the like. But what that experience drove home to me was just how different resources are in different parts of our Commonwealth, in between urban areas, rural areas, gateway cities, and the like. And so fundamentally, a lot of our challenges with COVID, a lot of the ways in which it has hit inequitably, just reflect the underlying inequities in our economy. And for us even to have...
So is there something specific you would have done differently than the current administration has done on COVID?
Yes, I would have moved a heck of a lot faster to build out testing infrastructure, for sure. I would have worked a lot harder and faster for federal partnerships for investment in that last March and April. I would have rolled out mobile testing a lot faster. And in general, I would have had free testing everywhere across the whole Commonwealth. We never achieved that comprehensive free testing everywhere across the whole Commonwealth that could have shut the disease down right in the very beginning.
And what would be the first thing you'd do on COVID if you were elected when you got into office? I understand that is a year from now, but I think it's still a relevant question.
I think there are things we should be doing today, which is that our state government should be mandating for state employees that they either be vaccinated or have weekly COVID tests. And I really want to lift up our treasurer and our auditor, who have shown leadership in both of their agencies on that front. It's just critical that our state agencies be workplaces where all employees have safe and healthy work conditions, and where all residents of the Commonwealth who need public services also are able to access them in healthy and safe ways.
Okay. So when you talked a little bit about your vision there, you talked about inequality and equity, you talked about housing, social infrastructure. All three major Democratic candidates are self-labeled progressives and talk about similar issues. Is there anything specific that you think sets you apart in terms of platform or policy from the group of progressives now in the race?
So I do share core progressive values with some of my fellow candidates, for sure. And I also bring a pragmatism to it. And partly that comes from long family tradition. I grew up in a family that has been deeply committed to the vote and empowerment over time. My great grandparents on my mom's side helped fight for women's right to vote in the early 20th century in Michigan. And my great grandmother was president of the League of Women Voters in Michigan. My granddad on my dad's side helped found one of the first NAACP chapters in Northern Florida in the 40s, which was a very dangerous time. So I'm from a family that has a sort of long history, long tradition of fighting for democracy, fighting for empowerment, and being really pragmatic about how to get that done, showing those results in the form of achieving the vote, achieving, change with others in the context of organizing for the civil rights movement and the like. So I believe in organizing. I believe in building coalitions. I believe in bringing people together and getting things done.
I'm going to back up for a minute. I realize there's a question I want to ask you and follow up to what you said about supporting state governments, agencies mandating vaccinations. Should we be seeing large-scale vaccine mandates? Should private employers be doing it? Do you think there should be federal action on that? How far should we go in mandating that people get vaccinated?
I do think that there are basic occupational safety and health issues here, basic OSHA issues. Every workplace should have a basic level of health and safety, and that does require, vaccines or weekly testing. So yes, I think every employer over a certain scale should in fact be doing that.
All right. Thanks for letting me go back and pick up that thread. I didn't want to leave it unchecked. So at the beginning, you also talked about your management capacity and your management potential. I want to push on that because I know you're aware you're the candidate who has not had experience working in government. You've been unapologetic about that. You've talked about your experience in the academic world as a strength. How so? How does that give you a strength in running government when you don't have experience in running government before?
Well, I've had lots of opportunities for managerial and leadership experiences in the nonprofit sector, and government is a nonprofit sector. I think sometimes we forget that. So I think that there's lots that translate. So I was fortunate to have an early leadership opportunity at the age of 32, was dean of the Division of Humanities at the University of Chicago. It's a small job compared to state government, but it was 250 full-time employees and $60 million annual budget, and have been leading teams and leading organizations to success ever since. So in that regard, I think what we are working on is about building teams to meet a transformational moment. And I have both a lot of experience building and leading teams to, again, organizational success and real clarity about the transformational moment that we're in.
So institutions like University of Chicago, Harvard University, now where you run Harvard Center for Ethics, they're large institutions with a lot of resources behind them. And the things that you've run are within those larger institutions. In the corner office for the state, there's nothing behind that but you, right? You and the state budget, the legislature. That can be really being out on a limb. What prepares you to be out on that kind of limb without a safety net in times as tight as these are?
So first of all, just a clarification, I am on leave from Harvard. And so there's now somebody else, my colleague Nin Hashad, directing that ethics center. So I want to make sure that that's clarified. And I have absolutely also led outside the context of universities. So I chaired the Mellon Foundation board, and that's a $6 billion foundation, with fiduciary responsibility for those assets and fiduciary responsibility for that $300 million annual budget. So I could go through other things that are outside of colleges and universities that I've also had the chance to lead. Work I've done as regional field organizer in the 07-08 Obama campaign. So in that regard, I have had lots of experience working in context without, what you're calling a safety net. But I also honestly think that's not the right way of thinking about how the things that grow in universities and then translate into the real world function. So if you look at the biomedical sciences, what you see is over and over again, folks building things that start in labs, start in the form of labs. Labs are themselves team management structures, and then they migrate out into the world, into one another form of entity. And in various ways, I've also had the opportunity to spin work out, often handing it off to other organizations and then helping them take it forward in the world, working closely with nonprofits and the like. So I do have a pretty broad view and perspective of how organizations rise and fall when they have no safety nets.
Okay, I want to stay on this for one more question. And I am not looking to play gotcha here, but I have to ask you, through the course of our research today, two producers and I each tried to Google your campaign website, and we each tried several different searches and couldn't get a link to your campaign site to pop up on the first page of results. So out of curiosity, we tried searching the names of two of your Democratic opponents, and their campaign sites were both the first result. That looks like an experience gap in the nuts and bolts of campaigning in the team versus maybe other seasoned campaigners. What is your reaction to that, and how do you close that gap, over the next several months?
I'm proud of my team, and I have people with just really extraordinary experience on my team without any question. And, I think if you take a look at who's on my team, you'll see that they have combined decades worth of experience running campaigns. So I'm not concerned about that at all. I had a pre-existing extensive public profile. That makes it harder, actually, to deal with the search optimization in ways that get your website up there on the first click. So we have a very specific kind of problem because of my pre-existing public profile. So we are certainly working that through. And I believe you me, the team is on it and they recognize the issue and it'll get done. And then, we're working on building a grassroots organization. That's the key thing. And so we have a lot of folks out there who are engaging. We've been running listening sessions over the Commonwealth over the course of the last few months with thousands of people participating. And so we're just really grateful that there are many different modes of connecting and engaging with people.
So let's talk about this larger competitive landscape. Massachusetts, I've asked this to the other candidates on the Democratic side as well. We're a state that traditionally likes to elect Republican governors. The offices have been held by Republicans for all but 8 of the last 30 years. And exit polling from 2018 showed that an estimated 47% of Democrats actually voted for Governor Charlie Baker. We don't know if he will run again or not, but we do know about that predilection among the electorate. So how do you create widespread appeal to the broad electorate if you make it through the primary and are the main ticket candidate?
We're just in a really critical moment in our Commonwealth and in our country more generally. And again, you look at the pandemic and you see that stark disparity of impact and you realize it really reflects an underlying problem with our economy where we have not been building in and investing a one Commonwealth economy, an economy that really does bring growth and prosperity to everybody, including those outside of Route 128. So the simple fact of the matter is that my focus on investment in infrastructure, the basic building blocks of infrastructure, is a whole Commonwealth approach to our economy. And I think that really responds to centrist concerns. As we've been running this listening session, these conversations all over the Commonwealth, we just hear from everybody, all different kinds of political perspective and backgrounds, that housing and transportation are the number one concerns. Now, when you address those, when you invest in that kind of infrastructure, it does support a broad footprint for growth across the whole Commonwealth. And that does respond to that, again, sort of centrist concern about making sure we always have a prosperous economy. At the same time, to do that work is how you reconnect people to opportunity and security. So that gives you a chance to address real questions of justice and equity at the same time. So we are in a moment in the Commonwealth where what we need actually combines progressive values and centrist concerns. So that's the case I'm working on making.
So last question to you, Danielle Allen. We have been in a moment where women of color are making huge breakthroughs in elected office. If you were to be elected, you would be the first Black woman ever elected governor in U.S. history. What would that mean to you?
Well, it would mean there was a heck of a lot of work to do. It would just mean that it was just an extraordinary opportunity to work with the people of Massachusetts to build that positive, proactive 21st century democracy that includes everybody, that delivers an economy that's good for everybody, and that really defeats the creeping authoritarianism we see around the country by generating a compelling alternative.
All right. That is Harvard professor and Democratic gubernatorial candidate Danielle Allen. Thank you for joining us today on Radio Boston.
Thank you so much. Great to be with you.
Wow, the pace of new information about the Delta variant continues to be breakneck, and a lot of it is coming out of the Provincetown cluster. What we've learned so far has led the CDC to change how we understand this new strain. Here's Dr. Rochelle Walensky, head of the CDC, speaking to the BBC.
One of the things that we learned in the outbreak in Provincetown is that if you were fully vaccinated and you happened to get an infection, that you did have a large amount of virus, similar to the many people who are unvaccinated who got infected. But I think the lesson learned here is how well the town did in the context of immense amount of exposure and high rates of vaccination.
So lots of questions out of Provincetown about the Delta variant, new mask guidance, increasing calls for vaccine mandates, questions about boosters. We will try to get to all of them and your questions in Ask the Doctors. 1-800-423-8255. That's 1-800-423-TALK. And you will be able to ask your questions of Dr. Sabrina Asumu, Assistant Professor of Medicine at Boston University School of Medicine, an infectious disease specialist at Boston Medical Center, and Dr. Shira Daron, infectious disease physician and hospital epidemiologist at Tufts Medical Center. Dr. Asumu, welcome back.
Having me on.
And Dr. Daron, welcome back to you as well.
Great to be back with you.
So, Dr. Asumu, we heard Dr. Rochelle Walensky there, head of the CDC, and we know from town manager Alex Morse that the outbreak in Provincetown was big, but is mostly contained at this point. Have you been watching that closely, and what lessons have you drawn from Provincetown?
Yes, no, thank you for having me on. We've all been watching this situation very closely because it teaches us a lot about our vaccines and our efforts to really impact this epidemic. So first of all, before anything, I'd like to emphasize that this is actually an illustration that our vaccines worked, and that this particular cluster could have been even worse if we hadn't had vaccines. The other important point to emphasize, which is what the CDC has emphasized at this outbreak as we're learning more, is that number one, the risk of infection, when you compare those who are vaccinated to those who are not vaccinated, is actually 8-fold lower for patients who are vaccinated. Number two is that if you're vaccinated, your risk of getting hospitalized or dying from COVID is 25-fold lower. And so, this is actually the message that we need to get out, and that the vaccines are working. And the good news, again, is that so far there have been no deaths associated in terms of patients who are vaccinated. So this is the good news, that the vaccines are working, and we keep learning. I mean, one of the things that probably impacted a lot what we saw is that there were large gatherings and maybe in indoor and poorly ventilated spaces. So this is a message we need to get out. If you want to be safe, if you want to have a gathering, be outdoors and space out and try to avoid crowds. But vaccination is still our way out of this pandemic.
All right, we'll go to the phones in a minute. I do want to put the number out again, 1-800-423-8255 to ask your question as those calls come in and we get them queued up. Dr. Daron, I want to turn to you, and I want to pick up on a theme from Dr. Asumu there. She said the vaccines work, and we saw that they work in Provincetown. In public discussion, one of the things that we hear people saying is, well, wait a minute, we now know, or it seems that we know, that you can be a big spreader of the Delta variant if you have it, even if you're vaccinated. We heard close to 75% of the people who got the coronavirus illness in the Provincetown outbreak were vaccinated. Understood, hospitalization and death, very, very low, lots of efficacy there. But if one contracts the COVID, you still have to isolate. You're still worried about spreading it to other people. That is leading to a sentiment for some that maybe the vaccines aren't working the way we said they would. Well, how do you confront that frustration?
Yeah, no, I understand that frustration. I'm frustrated too. A couple of things to clarify though. When we hear that 75% of those who were infected were vaccinated, that actually tells us nothing about the vaccine effectiveness in this setting. We believe that there were thousands of people in Provincetown that weekend that it all began, and that way more of them were vaccinated than unvaccinated. And so it's entirely possible that if you think about 3/4 of the people being vaccinated, you could still have had that be 80% of the unvaccinated people there infected and 8% of the vaccinated people there infected, still showing a good 90-85% effectiveness of the vaccine as we believe it to be. So that number in itself is not worrisome in the slightest. What's worrisome and what we learned from this is that there was onward transmission from vaccinated people to other people. And that's what we had hoped not to see based on the data from prior strains showing that people who do get a breakthrough infection with COVID-19 after vaccination have a lower viral load. But vaccines are still the way to get us out of this mess. The more people we have vaccinated, when we have, holiday weekends with full nightclubs and everyone is vaccinated, we expect this kind of thing not to happen.
And so also, if I understand you correctly, it's also a matter of if you have a group of people and everyone's vaccinated, then of course you're going to have cases among the vaccinated just because that's your denominator. That's the set you're drawing from, right?
Absolutely.
All right, that's helpful. So I think we've got the lines full. Just one follow-up question on this. And I'm trying to sort of tap into the yin and yang of what we are learning from Provincetown, the changes that are happening, Dr. Asumu, in policy, and the regular messaging from public health officials. The vaccines work. Vaccines are still the answer. How to think about the fatigue of this possibility of having to return to indoor masking, not being able to eat inside in restaurants anymore, et cetera. How do you encourage people in the face of that fatigue and that worry in this moment?
Yeah, no, these are very important issues. So number one, I'd like to first congratulate the people of Massachusetts who have really gotten vaccinated at really high rates. And we are in much better shape than certain places around the country. So number one, I want to say that our picture is looking very different because people did do what we recommend and they got vaccinated. On the other hand, I really understand that it could be frustrating because we felt like, our way out is to get vaccinated. And then many people got vaccinated so that they can get back to a normal life and start to engage in certain activities. And here we are now, we turn things around and we say, okay, no, actually, you do have to wear a mask after all. And one important thing to emphasize is that the reason why the change was made was because of new data. The science changed, the cluster and Barnstable kind of taught us different lessons because with the Alpha variant, it was that we pretty much thought that it was unlikely for you to transmit, but now we're getting new evidence. So this is why the recommendations are changing, is because the science is changing, but we're in a much better place than we were, let's say, a year ago in 2020. I was, on the front lines at the hospital, and I was just on service again 2 weeks ago, and it's a stark difference compared to like what we face. So there is progress, but, with the Delta variant and this current surge, we're hoping that this may be temporary if we do our job and that we get as many people vaccinated and protected so that we're in better shape for the fall. That is our hope. So I understand the frustration, but also let's look at the big picture. We are in a far better place than we were before. And at least we have the solution, which is vaccination to help us get there.
Okay, Dr. Asumu, Dr. Daron, I'm going to go to the phones now. The lines are blowing up, so let's get through as many of these as we can. We've got Tracy on the line in Newton. Tracy, go ahead.
Hi, I work in an animal clinic, and it's a small space. We can't really social distance. We're all supposed to wear masks. My concern is a couple of my colleagues are coming back from vacation from high-risk area, and our company said that they cannot require them to do testing before they come back. So I'm wondering what is the best way I can protect myself. And I live with someone that is immunocompromised. Thank you for the question, Tracy. Dr. Daron.
Yeah, I think the messaging on this has been fairly confusing because we have always said my mask protects you and your mask protects me, and that vaccines are best at preventing us from spreading to others. But with the increased availability of good quality PPE grade masks, people really can use them to protect themselves. And so what you really want to have is a disposable multi-layer mask that fits well on the sides of your face, tucks under your chin, and with a bar across the nose that you can mold to the shape of your nose. And if you have that, you are really quite protected. And it's what we use in the hospital with patients, asymptomatic patients, some of whom turn out to have COVID.
So is that paper surgical mask that we can now buy in bulk that's got a little bit of metal around the nose to shape it?
That's right.
Okay, thank you for that. All right, 1-800-423-8255. We've got Laura on the line in Cape Cod. Laura, go ahead.
Hi, my name is Laura, and I'm calling from Cape Cod. My daughter had COVID in March, and then she was vaccinated. She works at a restaurant where they don't require her to wear masks. Should she wear her mask starting now and request that of the restaurant?
Dr. Asumu.
Yeah, no, this is a very good question. First of all, I'm really glad that she got vaccinated. This is, the way that she's going to protect herself and protect everybody else around her. In terms of so first of all, let's think about what the CDC guidance says. So the CDC guidance says if you are in areas that have either substantial or high rates of COVID, then we should use masks indoors, and so in places such as the restaurant that you're describing. And I know it's a hard thing to do. You have to go to the website and figure out, where we fit. And then the other thing that may be confusing for the general public is that then the state of Massachusetts put out their guidelines, which said currently that you should wear a mask if you have a compromised immune system, or if you're at risk for severe disease because of age, or if you have an underlying condition, or if you're around someone who's at high risk or has any of those criteria. So it makes it a little confusing because we don't have like one message, and it all depends on where you live and what other conditions. But, at the current time right now, she lives in a place where, she's not going to know people's vaccination status. It's a restaurant. And, one thing I could say is like, she can look to see where she's located in the restaurant. But I think at the current time, with the surging in cases, it wouldn't hurt for her to wear a mask, as Dr. Jerome said, a well-fitted mask that's going to fit to the shape of her face. But, with vaccination and with a well-fitted mask, she's going to be very well protected. And it will be nice if others around her can be encouraged to sort of wear a mask as much as possible.
And just for a note for you, Laura, Barnstable County is in the substantial or high rate of transmission, so the CDC recommendation would apply there in Barnstable County. Let's go 800-423-8255 to Aaron in Ashland. Aaron, go ahead.
Hi. So I have a question about vaccines for children. My son is 12, but he has friends who are younger. And one of the things that we've been talking about among our parent friends is why they're not rolling out vaccine availability for, like the 11-year-olds and then the 10-year-olds. And why are they waiting for such a large age spread in order to approve the vaccine for the younger kids?
So, Dr. Derone, and I just want to note, we're talking about authorizing it for emergency use. Approval is a second stage. And I'm not correcting you, Aaron. I'm just making sure we keep it clean for our listeners. Dr. Derone, go ahead.
Yeah, so the studies in children under 12 are ongoing, but not complete. And it's really important, both the FDA and the CDC, that the studies be done in such a way as to reassure the public that they are both safe and effective in that age group, and that any risks are far outweighed by benefit. As you go down in age, it's harder to prove that the risks are outweighed by benefit because the risks associated with COVID get smaller and smaller. So they had been asked to increase the sample size of participants in the study to be able to get a better sense of safety, especially given what we learned about the very rare cases of heart inflammation, myocarditis in mostly young men in the older age group. So for that reason, it is now estimated that it may be winter or even 2022 before there is even an emergency use authorization for children under 12.
Wow. I'm sorry, I'm reacting. I didn't realize that last part that you said. And just one last piece. Aaron asked, why not go to the 11-year-old then the 10-year-old? Would it have changed the timeline to do smaller age cohorts, or does that not matter in how this rolls out?
No, I think it would have delayed it for each younger cohort had it been done that way, because they will be able to make conclusions on the entire cohort based on this next study.
Thanks, Dr. Derone. 1-800-423-8255. We've got Steve on the line in Cambridge. Steve, go ahead.
Hi. I'm a senior. I'm 81, in good health, tested negative for the virus prior to getting the Pfizer vaccine, the second one, in late February of this year. So I'm 5 months in. I have an opportunity for a research study at a well-known hospital that will involve being in an MRI scanner. My concern is I'm not quite sure what precautions they will take, but it's obviously an enclosed space. If the prior person, and there are a number of MRIs going on, if a prior person is infected, what I'm concerned about is contracting the virus, even though I've been vaccinated, and the possible effects of that. So it seems to me it involves either asking them to disinfect before I go in. Obviously, probably.
Steve, I'm going to take it back from you there. And Dr. Asumu, this gets to, it's almost like in some ways with the Delta variant, we have to have a reboot of some of our sort of, classic isn't the right word, but some of our original COVID questions. Things like surfaces, transmissibility in small spaces. Here we are again with this new variant asking these questions again. So is there a different concern on surfaces like the one that Steve is raising with the Delta variant? And what should be his expectation for cleaning in a situation like this?
Well, it is the same virus. And so our thoughts currently are not that the fundamentals about this virus and transmission we don't expect them to change. So in terms of modes of transmission, we still believe that, the old modes of like respiratory and respiratory droplets is going to be the main mode of transmission that we should be worrying about, and surfaces are unlikely to play a significant role. The second point that I'd like to make is, he's going into a hospital, and for many months now, we take a lot of precaution, and we make sure that we clean all surfaces and all areas, and that we follow very strict safety protocols, and everyone is masked, in the hospital. So, I want to emphasize that, the hospitals, the clinics are very safe, and we've come a long way to making sure that we can safely welcome all of our patients back.
So, Dr. Derone, we have just a little bit of time left. I'll come back to you one more time and ask you, as we continue to learn more about the Delta variant, what's the biggest question on your mind right now? Just briefly.
Well, I think, I don't know if we will learn it, but I think we really need to understand who's at risk out there in terms of severe disease, hospitalization, and death, both in the unvaccinated and the vaccinated. That's just been the question for the last 18 months that we just don't know.
All right. That is Dr. Shira Derone, infectious disease physician and hospital epidemiologist at Tufts Medical Center. Also with us, Dr. Sabrina Asumu, assistant professor of medicine at Boston University School of Medicine and infectious disease specialist at Boston Medical Center. Dr. Derone, Dr. Asumu, thanks for your time today.
Thanks so much.
Thank you.
And that's our show for today. Radio Boston is produced by Jamie Bologna, Chris Siderick, Walter Wuthman, Amanda Beeland, and Cynthia Betubiza. We had help from Stephen Gelman today. Marquise Neal is our technical director. Our executive producer is Hitesh Hathi. I'm Tiziana Deering. Thanks for listening. Join us again tomorrow for more Radio Boston.